Chapter 7, Physical Rehabilitation and Therapies. Recovery from a stroke involves more than just medical treatment. Physical rehabilitation is an essential step on this journey, playing a pivotal role in helping regain strength, coordination, and balance. It is instrumental in improving the ability to carry out everyday tasks. This chapter aims to guide you through the objectives of physical therapy, the diverse techniques, exercises, and their contribution to your functional recovery. Let's start by understanding the goals of physical therapy. The primary objective is to assist you in regaining as much physical function as possible. The scope of these activities is broad and can include walking, climbing stairs, or using your hands for eating and dressing. Your therapy program will be personalized, catering to your unique needs and abilities, and will evolve as you make progress. The goals of physical therapy can vary, but they often include improving strength. A stroke may result in muscle weakness on one side of your body. Strength training exercises can help rebuild this lost strength. Increasing mobility. Physical therapy is instrumental in enhancing your ability to move and perform activities of daily living, ADLs, such as bathing, dressing, and feeding yourself. Enhancing balance and coordination. A stroke can impact your balance and coordination. Therapists will guide you through exercises to improve these abilities and minimize the risk of falls. Restoring functional abilities. This could include training to improve your ability to walk, use your hand, or perform other specific tasks. The ultimate objective is to assist you in regaining as much independence as possible. Your physical therapist will guide you through an array of exercises tailored to your specific needs and goals. These exercises could include range of motion, ROM, exercises. These exercises aim to maintain flexibility and joint function by moving your joints through their full range of motion. For example, stretching your arm above your head or bending and straightening your knee. Strength training exercises. These exercises aim to rebuild muscle strength and may involve resistance exercises, such as lifting weights or using resistance bands. Balance and coordination exercises. These exercises aim to enhance balance and coordination and could involve standing on one leg, walking heel to toe, or using balance boards. Gait training. If your ability to walk has been affected, gait training can be beneficial. It might involve practicing walking with assistive devices or working on improving balance and stride. Functional recovery refers to the process of regaining the ability to perform daily activities independently. This can range from personal care tasks like brushing your teeth or getting dressed, to more complex tasks like preparing a meal or driving. The journey towards functional recovery varies for everyone. It depends on a multitude of factors, including the severity of your stroke, your overall health, and your personal goals. Yet, with diligence, persistence, and the right support, substantial improvements are possible. It's important to remember that progress can sometimes be slow, and setbacks may occur. However, these are normal aspects of the process. Patience with yourself is key, as well as celebrating every little accomplishment. Each small step you take brings you closer to achieving independence, no matter how minute it may seem. Working alongside a physical therapist can have a significant impact on your recovery. They can offer guidance, motivation, and support. They also ensure that you're performing exercises correctly and safely. In conclusion, physical rehabilitation is pivotal in stroke recovery. It helps reclaim physical capabilities, enhances independence, and improves overall quality of life. It's important to remember that everyone's journey is unique, and progress requires patience and time. By staying determined, persevering, and receiving appropriate support, you can make considerable strides towards achieving your recovery goals.